Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you on how to make post-operative bed. And guess what, my equipment are set, so do not forget to like, share and subscribe to my YouTube channel, right? I love you all. Thank you for all your support. To my beautiful students, thank you for your support. To students around the world, thank you for your support. Thank you for sharing my videos. Thank you for liking it. Thank you for watching it. Please sit back till the end of this video and learn how nurses make post-operative bed to nurse post-operative patients. Okay, before we make post-operative bed, of course, in nursing, any procedure that you are going to do, you must make your requirements ready. Make the available requirements for the procedure ready. So I have my equipment here. They are ready, and all these equipment are for post-operative bed. Of course, remember, the aim of making post-operative bed is to get ready to attend to patients that prepare for the unforeseen, for patients that are coming from the theater, right? So you have to get set, make sure that all equipment are ready, and the aim is to provide warm and get prepared to any unforeseen emergency. I have pillowcase, 2 bed sheets, 2 blankets, 1 drawer Macintosh, 1 dressing Macintosh, 1 towel. On the process of making this bed, you will see how I will lay all those sheets, right? And of course, I have drip stand. Of course, a post-operative patient, you know that he or she must be on fluid, right? So I have my emergency tray. Of course, you see this emergency tray to prepare for if the patient is having excess fluid secretion, or there is the tongue is falling. I have my mouth guard, I have plastic airways, I have tongue depressor, plain dissecting forceps, and of course a long artery forceps, and I have my gauze here. And also I have emergency medication such as hydrocortisone, promethazine, normal saline, set for any emergency that may come up during nursing this patient, right? I have my suctioning machine. Of course, my suctioning machine is functional, and I have my oxygen cylinder, functional oxygen cylinder, right? So all those requirements, they are for the making of this bed. And of course, CPR tray. You cannot make post-operative bed without a CPR tray, of course. Remember, you'll be monitoring the patient depending on the condition of the patient. It can be 10 minutes. It can be what? It can be 15 minutes, 30 minutes, depending on the patient's condition, right? And also, remember I said the aim of making this bed is to provide warmth. If there is no room heater, you have to provide warm the bed by using these hot water bottles, right? All these are for the requirement for making of this bed. So now remember, as a student nurse, during exams, if you are asked to make a post-operative bed, remember, it's not a 1 nurse procedure, it's 2 nursing procedure, right? 2 nurses must make the bed. If not, as a nurse making the bed, you'll be exhausted. So before I make this bed, permit me to go and get an assistant to help me make this bed, and from there we're going to perform hand hygiene and don gloves. Thank you. So I am my assistant. We have performed hand hygiene. So of course, during exams, please, student nurses, student midwife, do not forget, please always try to dry your hand, be it using towel or you use hand dryer, so that when you are coming to put on glove, you will not struggle and you will not just waste time. My assistant have worn her glove, and I'm putting on my glove. Remember, this is a clean procedure, not a sterile procedure, of course. So we are using latex glove to perform this procedure, right? So first thing first, we have to put the bottom sheet, place it at the middle of the bed, and ask your assistant to assist you to spread the sheets, right? to spread the sheets evenly on the bed. And remember, you have to make foundation bed first. So if you miss the length of the bed sheet, do not forget to turn it. So you and your assistant, remember the nurse that is making the bed, do not forget the nurse that is making the bed, she's having the requirements close to her to have easy access to the requirements. So we tuck in the head end of the bed, make an envelope corner. So careful, making sure that you work in harmony with your assistant. Tuck in the foot end of the bed, making sure that you make your envelope corner, make it look neat. Avoid leaving wrinkles on the bed so that it will not predispose your patients to pressure sores. Pick the next Macintosh, place it same, middle of the bed. Do not tuck in. Pick draw sheets, also place it at the middle of the bed. You ask your assistant to help you open the sheets and cover it. If you have something like this that is large, make sure that you tuck in the edge, making sure that the bed is neatly dressed. Together with your assistant, you tuck it in. Right? So remember, when you are making post-operative bed, the next thing is for us to place the dressing Macintosh at the head end of the bed, right? You place it at the head end of the bed, and also bring a towel. Bring a towel and cover the dressing Macintosh. The aim of this is to prevent secretion staining the bottom sheets, right? So you tuck it in, make sure that it's looking neat. Remember, the next thing is for us to place the bed sheets together with your assistant. You evenly spread the bed sheets together. Remember, the nurse that is making the bed, can you draw to your side? Always give instruction to the nurse that is assisting. And do not forget, during exams, do not allow your assistant to dominate you or to give you sign or to tell you what to do. That is exam malpractice. Please avoid that. So we spread it evenly. Spread the sheet evenly with my assistant. And also bring the blankets, right? Also spread it together with your assistant. So we spread it, even though the bed sheet is longer than the blanket, spread it evenly. So I asked my assistant to tuck in her side. Allow your assistant to tuck in her side. Tuck in both head end of the bed and the foot end of the bed. Making sure to make an envelope corner. Instruct your assistant to tuck in. Tuck in. Pull the blanket. Alright, you go. So, after the assistant have tucked in her sides, then the nurse that is making the bed stylishly unfold the top sheets, that's the blankets, and the top sheets together, right? Kindly make sure that while you are doing this, It's always neat. Make the bed look attractive. Of course, you are a nurse. Pull that side for me. So you make it in such a way, like in a triangular shape, right? After making this, right, then you start unfolding it. You unfold it this way. You unfold it this way. Give your assistant straight. Just make it straight, right? And the next thing is to add the next blanket, right? So I place the next blanket and we spread it together with my assistant. So for the last blanket, there is no need for us to put another bed sheet, right? Also, again, ask your assistant to tuck in her side, right? So you wait for your assistant to tuck in her side. After tucking in her side, then the nurse making the bed, do the same thing that she did with the first top sheet. Making sure that the top sheet is looking neat on the bed, and unfold it this way. And ask your assistant to spread it. The next thing now is for me to place the hot water bottle. And to achieve that, to make the bed warm, to make the sheets warm, you have to open the hot water bottle, fill it up with hot water. Fill it up with hot water. After filling this with hot water, then you close it tightly. So to avoid spillage on the bed, you close it tightly to avoid spillage, right? So you can have 2 or more of hot water bottle. Fill them up with hot water Make sure that you close it tightly and then put it in between, right? You can have 2 or more in between, right? So the next thing is for us to put pillowcase. A pillow. Remember, in nursing, when you are making post-operative bed, putting pillow is optional. If the patient is on, they use general anesthesia on the patient, you offer the pillow to the patient when the patient regain consciousness, recover from the anesthesia. But if the patient, if the surgeon during the surgery, they use spinal anesthesia, the patient stays on a maintain supine position for 24 hours without using pillow. So we'll make the pillow ready and place it on a chair, right? So we are not going to put this pillow on the bed. So normally in nursing, you turn the pillowcase inside out this way, and then you put in your hand and ask your assistant to pull the pillowcase. To pull the pillowcase, getting ready to receive this patient. And remember, allow your assistant to go and place the pillow on the chair. This time around on the chair, not on the bed, right? The next thing is for me to place all this emergency tray. Remember, we are preparing for the unforeseen, right? So I take the CPR tray, give my assistant to place it on the bedside table. Give the next one, she places it also there. And then my emergency drugs, she also placed it there. And my vomitus bowl, of course, my vomitus bowl should be closer there also. We arrange it this way on the bedside locker. Arrange it properly so that get ready for the unforeseen situation, right? So the next thing is for me also to place the drip stand. Place the drip stand, getting ready to hang the fluid the patient will come from the theater with, or put another fluid that we have in the ward, and also get ready with my suctioning machine. Of course, the suctioning machine is functional and it's ready, and my bowl with water to flush the tubing in case of excess secretion, right? In case of excess secretion, so I place the suctioning machine, right? My suctioning machine. I place, of course, my oxygen cylinder ready, with the face mask ready with oxygen inside, and I place it by the side, making sure that everything is set to receive this patient, right? Everything is set to receive this patient. So the side that you are going to bring in the patient must be open. If you notice that I give way here, I give way all through this side, with getting ready, leaving space to receive this patient. So whenever the patient is wheeled to the ward, the patient will be placed around the bed this way, and the patient will be taken into the bed. Remember, before you place this patient, you have to remove the hot water bottles, right? So now this bed is ready and all the equipment are ready for the post-operative bed. Before we go, remember, every procedure that you do, you have to remove your gloves. You have to remove your glove, right? So I'm done. I have to doff my glove. Remember, if you are removing glove, you have to pinch from the middle at the side, pull, squeeze, and then use your index finger to avoid contamination, right? And then pull. After doing this, of course, you discard inside the bin, right? After doffing my glove, of course, the next thing is for me to go and perform the last hand hygiene. Of course, me and my assistants, we have to go and perform a hand hygiene. To perform the last hand hygiene, I have to on my tap, back of my hands off the tap, and then I dry my hand using dryer or hand towel. I have performed my last hand hygiene. That is the end of post-operative bed making, right? I hope you like this video, and I hope this video is helpful. At least now you will not have issues when you are making post-operative bed, most especially for Nigerian students, right? At least, thank you for your support. Thank you for your love. Keep watching my videos, and if there is any procedure you want me to do, please drop it at the comment section. Please do not always forget, like, share, and comment on the procedure. Thank you very much. I love you. Bye bye.